The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today we have the author of the hot book, Get Moving, Live Better, Live Longer. With us we have Dr. Ruth Anderson. Dr. Anderson, welcome to the program.
Thanks.
Now, we've had you on the program before talking about pain management, things like that. Now, for those people, and by the way, I skimmed through the book. You said you got to read the book, so I will take a look at it.
You didn't listen to me.
But actually, I read the first chapter. Loved it. It was very good. The part on nutrition, so I was very impressed. So before we get into, I have a bunch of questions about the book. But for those who don't know you, tell me a little bit about your practice, your background and training, and then, of course, why the book?
I'm a practicing pain management specialist in La Quinta, California, near Palm Springs. I'm board certified pain management and anesthesiology. I've been in the desert for about 6 years now. Before that, though, it was a long, torturous road. I have a master's in exercise physiology, and I was a dancer even before that, and danced in New York City, where I hurt my back, yeah.
Okay.
That was a long ago and far away, but yes, sir. And all of that background, the exercise, the wellness, the dancing, combined with the MD is really why it all came together, and I wrote the book, Get Moving, Live Better, Live Longer.
Now, you have lots of pictures in the book, a lot of how-tos, demonstrations, and you know, on the cover, combat disease with this medically proven exercise guide. You believe that?
That's exactly what this is. It is a medically based guide to prevent and in some cases cure disease.
Really?
Absolutely. And the data is there. This isn't hype, it's not a gimmick. It's hard science, it's based only on science. I say nothing that I can't prove.
Now, how is it different, by the way? A lot of books on health and wellness and getting moving. How is it different than, you know, all of the other books?
It's the combination.
As you see it.
It's the combination. You take my expertise. I'm probably one of the best trained trainers you're ever going to meet.
Okay.
Double boarded MD. I don't think it gets stronger than that. And so I've taken all that fitness expertise, all the years that I've taught exercise, and all the years I've been doing it myself and living health and wellness really for the last 30 years, and combine that with all my medical expertise and my knowledge of disease, and so I wrapped it up in this really super deluxe package.
So your patients, the patients that go to see you in your private practice, you give them so you're doing combination therapy of exercise protocols, nutritional protocols, in addition to the other things?
Well, the practice is the practice.
Okay.
And I really run a medical practice treating pain management patients. I use injections, we use medications. I mean, it's standard medical practice, but all my patients know my passion for exercise and how strong I feel about it. The problem is, within the medical model, there's no time to kind of hand carry and walk my patients through everything I would love for them to know about exercise.
So now what do you do? You tell them to read? Do you tell them read the book?
Go read the book.
Go
buy my book.
How are they responding to it, by the way?
You know what? I'm getting such wonderful feedback. I'm really blown away. And I have patients who'll read it and they'll buy 3 more for their friends, and so it's, you know, it's very new. You know, you're cutting edge here, getting me on here today.
Yeah, you know, there's not, going to the bookstore, I said, I'm going to get your book. You go, Randy, I'll just send it to you. But I looked at the other titles. A few medical doctors are writing books out there, but not in this combination. You know, the exercise component, the longevity component.
Exactly right. Doctors have the medical expertise, but they don't have the time, but they also don't have the exercise understanding or the wellness understanding. Trainers, you see a lot of books out there written by trainers as well, but they don't have the medical background to tell people how to exercise if they have disease. And we cover the 6 big ones. If you have high blood pressure or heart disease, diabetes, chronic low back pain, arthritis, or osteoporosis, you can go to your trainer and you can go, okay, I've got high blood pressure, what do I do? And if that trainer has any sense, his palms are going to start to sweat, and he's going to get a little buggy-eyed because he knows he doesn't have the background that it takes to help you exercise safe. He also doesn't know how to use exercise to fight the disease, prevent it, and in some cases cure it. And that's where this book steps in. Now, it's absolutely unique.
Have you always wanted to write a book, or this book?
No.
Has this been in your head for years?
Well,
No.
I've been living it for years.
Okay.
But no, I was the girl in college English that spent the whole semester in tears because I didn't think I could write. And I literally, I opened my own practice about 3 years ago, and one of those eureka moments in the shower, I'm going, I need to write this book. And that afternoon, the kids came home, and I had papers sprawled everywhere, all over the kitchen table. They're like, Mom, what are you doing? I'm like, well, I'm going to write a book.
Is that right?
Yeah, they didn't put their backpacks down. They just kind of walked through into the kitchen and said, okay. And you know what? It wrote itself. It literally did. I am not a writer, but you'll hear me in there. You'll hear just the way I'm talking now. That's how I write. Conversational, easy to follow.
So backing up, you mentioned hypertension. Okay, so what are your recommendations there? And what do you do?
Well, let me tell you first off how important this book is.
Okay.
And we'll use hypertension as the first example. 1 in 3 Americans have high blood pressure. Half of them are poorly controlled with medication, which means that hypertension is a ticking time bomb waiting to cause strokes and kidney failure and on and on. So medicine's falling down. Exercise, first is prevention. Half of us, if we were doing the correct exercise program, and you need to read the book for that.
All right, okay.
Half of us, if we were doing the right exercise program, would never get high blood pressure.
Really? You believe that?
No, it's not a matter of believing. American College of Sports Medicine, physicians stand, summarize the data, and it's all right there. The hard science, it's been there for 30 years.
But if you're really in pain or sick, how are these people, I mean, don't they all know they have to exercise? They can't do it.
But they need to know,
Okay.
they need to know how. And
All right.
I honestly believe that Americans want to be better, that we want to be healthier. But if you don't know where to go or what to do, how can you stay motivated?
I know you're a workout person, by the way. And this is on those lines. We talk about personal trainers. Do you sometimes cringe when you see what's going on? Here you are, a pain management, exercise physiologist. When you go to the gym, because I know you go to the gym, do you see things?
I cringe.
Really?
I see lost souls day in and day out.
Is that right?
Well, you go in and you putter a little bit here and you putter a little bit there, and pretty soon, your year membership has about 11 months left on it, and you're not back at the gym. I think if people knew what to do and knew how to do it and how to progress, it would be a no-brainer. But I'm not done with hypertension.
Okay,
now.
let's talk about hypertension.
So first off, you can prevent it. Half of us can easily prevent it. And the scary thing is, once you turn 50, you got a 90% chance of being on blood pressure medicine for the rest of your life. 90% of us over the age of 50 are looking at hypertension. Now, in addition to prevention, you can cure your high blood pressure with the right exercise program.
Okay.
Okay? You get a blood pressure lowering effect with the very first exercise session that you have.
Can you wean people off of their, have you seen it
You
done?
do. 75% of the people can be cured. Again, data, not hype. 75% of the people who have high blood pressure can come off their medications. And diabetes is no different. Now, diabetes, you have to combine weight loss with the right exercise program. But again, like high blood pressure, you lower your blood pressure up to 22 hours after the first session. I mean, we're a land of immediate results, right?
Okay.
I mean, that's immediate.
So people lose weight with your book as well. I mean, that's part of bringing the blood pressure down?
Absolutely, absolutely. And there's a whole chapter on nutrition with the focus being, that weight loss is critical.
So in your book, okay, so I guess a lot of diseases are treated. Arthritis.
I've covered the 6 big ones. Arthritis and pain are a real different kind of animal than the other diseases. The other ones were high blood pressure and diabetes and heart disease. And that's really kind of a cardio program, right? What we used to call aerobics way back then.
All right.
But you can use weight training to help with any of those as well. So those go hand in hand. But arthritis and pain, they're very different animals. And that's why I chose to title the book Get Moving, because get exercising is one part of the deal, but get moving is another part. And that's
But
probably...
isn't that the challenge, though, that these people can't
Exactly,
get moving?
Exactly. If you were to x-ray all of Americans, the majority of us, at least over the age of 40, would have arthritis in either hips or knees.
Is that right? Okay.
By x-ray.
Mm-hmm.
But no doctor's going to treat an x-ray. We're going to treat the patient. So say we all have, arthritis. Who decides who's going to have pain and who's not? Well, the people who are exercising and having strong muscles, those are the ones that are going to avoid the pain.
Okay.
Okay.
So do you have it laid out where it's like beginning, moderate, advanced?
Love the question.
All right.
I do. I walk you through step by step, and it's really easy to follow. And especially for arthritis and pain, I'm talking about 10 minutes. You know, every day is how you should start.
Do they have to get a ball? Do they get some dumbbells, some weights?
You know, a ball and dumbbell are nice, but I've tried to do a lot of exercises that you can do at home. But even little things, get moving. There's little things throughout the book, because that's the first thing everybody has to do. We are getting so sedentary. We sit all day, 8 hours in front of a computer at work, and then you go home and TV is another 4. I mean, we're not moving. And now they're showing that the risk of just being sedentary is as dangerous for your health as it is to not exercise. So when you brush your teeth, stand on one leg. You know, don't just stand there and plod along. Stand on one leg. All of my patients in my pain clinic, every one of them says, I can't balance. I'm losing my balance. And I look at them and I go, what are you doing to practice?
Okay. Do they follow these? Do they follow these recommendations?
Yeah.
Is this book, by the way, is this meant to motivate them? Is it also, I mean, it's definitely a how-to. I mean, this is a specific how-to. I mean, everything, literally, there's pictures of everything.
I believe that if you know what to do, you will be motivated. The chapters start with why you should exercise, you know, how prevalent the problem is. You know, maybe old Uncle Ed had a heart attack and you don't want to go that way. Or arthritis runs in your family and, you know, you don't want to grow up crippled the way your aunts and uncles are. It gives you reasons why. Then it spells out precautions that you need to take. Because people with high blood pressure and heart disease, exercise is really important, but you've got to know how to do it safely. And that's not out there in the fitness literature
either. Are they confused?
either.
I mean, do you face patients that, because I don't meet people that talk about these kind of things. So my question to you is, are they confused? I mean, are you surprised sometimes that with the questions? And
I am surprised. Day in and day out. And you get blank stares.
Like educated people that...
There's so much hype. There's so many gimmicks out there. There's no way you could sort through all the garbage. And that's why the book is here. And
to eliminate that confusion.
As best I can.
Like a clear roadmap.
It does. So it tells you why to exercise, the precautions to take, how to get started, and then how to progress safely. Things to watch out for, danger signs, medically based. It's absolutely medically based.
So heart disease, I mean, you have a chapter on heart disease.
Absolutely, and
how does it help those people?
Disease. Well, we talk about cardio, which is short for cardiovascular. Like I told you, is the old term aerobics, and it all relates to how strong your heart is, how strong your whole cardiovascular system is, heart, blood vessels, and everything. And the stronger the heart's like a muscle. It is a muscle. It's like your biceps or your quadriceps, your thigh muscles, and the more you exercise it, the stronger it gets. And what my patients are finding is that, just 10 minutes a day is all they're starting. But the more they do, the stronger that heart gets, the easier it is to live day to day, do simple things like carrying groceries or run up the stairs to answer the phone or any one of a number of things. And that starts to breed such a feeling of control that, they've really taken charge of their life. They've made really positive steps. And that's very self-reinforcing. They get stronger, they get happier, relationships are better. I mean, it just snowballs.
So they become more active across the board.
Across the board. So that they're doing the little things I tell them to get moving, They're brushing their teeth on one leg, they're doing deep knee bends while they're waiting for their food to heat up in the microwave. All those little things start to really build up. And they're looking at their lives. Like I said, I practice in the desert. My patients are 60 years and older by most part. And you know what? It's never too old to start. Okay, you're never too young to need the prevention. But at 80 years old, science will show you can make the same kind of impact and you can get stronger and healthier even at 80.
So who should read the book? I mean the demographic when you wrote it, is it the 60-plus crowd? Is
yes.
it the pain crowd?
Yes, it is anybody who wants to prevent disease and get a leg up, ideally from age 20 on, but you're never too old to start to see the benefits. And you're never too sick to start to see the benefits. And with hypertension and diabetes, you can get off your meds. Use those hundreds of dollars a month to buy that Prada purse. Stop throwing it at the pharma companies, and let's take hold of health care. My mission, I've decided is to lower the cost of health care, one healthy person at a time.
And you think you've accomplished that?
I can.
Okay.
I will.
Now, the way you practice pain before and the way you practice pain now, I guess you've always been in, but this book allows you, because you don't have the time, as you said at the beginning here, this allows you now to combine traditional medical therapies with exercise and nutrition.
Exactly right. I start to teach each of my patients the value of exercise and how, if they don't give me something to work with, they can't sit 8 hours a day, 12 hours a day, and expect my pills or my shots to do anything. What is it? A silk purse out of a sow's ear, right? The old saying.
Yeah.
You got to give me a bit of the silk here. And so they say, well, what do? I say, read the book. Read the book.
A chapter on low back pain.
Well, pain is the biggest reason people come to see the doctor. Not the common cold, not anything else, but pain. And most of us, I think over 75% of us will have at least one episode of pain, of chronic low back pain in our life. The question is, are you going to let that episode of low back pain be an isolated incident that maybe lays you up for a day or two, or are you going to give into it, get weak, and let that acute episode of pain kind of snowball into what becomes what I take care of in the office, which is chronic pain?
And those people can exercise.
They have to exercise.
If you're in chronic pain, really.
Your doctor will tell you if you have a flare of pain, 1 to 2 days bed rest, no more. Because being sedentary, being inactive is basically asking those pain pathways to get sicker and sicker. I tell my patients they're going down that toilet of inactivity. You have got to pull yourself up by the bootstraps.
Okay, so this will air not only on television but on the internet throughout the United States. Okay, so they don't have access to Dr. Ruth Anderson. But let's say they're on a pain regimen of some sort, okay? With a doctor, with a chiropractor, with a physical therapist. This should be combined with their treatment.
The chapter on pain is, I think, the most educational because people have such a misconception about pain. They figure if it hurts, you shouldn't move it, right? I mean, pain must be a signal. Because when you break your arm, owie, owie, and you don't move it, and it's protective. The problem is with back pain and chronic pain, it's not protective. That pain is a disease. It's a dysfunction of your nervous system. Your pain pathways have run amok.
Interesting.
And if you listen to it and give into it, you're toast.
But will these exercise? Because some of them, okay.
They will. The teaching will help. The exercises, they're my favorite core exercises. Core strengthening, I think, is one of the strongest sections in the book. And each chapter focuses on different core strengthening exercises.
Is this you in these pictures?
Some of them.
So
yes.
They all look like you.
No, some of them are Shelley Cooper and her staff of physical therapy.
Prevention, though. Okay, so prevention.
Prevention is key.
Is it hard to sell prevention, though? Don't people like to wait until they're falling apart?
Yeah, Obama's helping with that. And the new health care plan, I hope people are realizing, and just the reality of, financially, everything in this country. We've learned very quickly and very hardly there's no quick fixes. And if people don't start to take control of their own lives and their own health, we don't stand a chance. What this book will teach each of you is that you have more power than any pill I could ever prescribe. And it's all right there.
Well, good for you. You believe that.
Oh, God, passionately.
All right.
Absolutely.
Okay. So they can order this on your website?
They can order it on the website. You can get it on Amazon.com. You can get it on Kindle or Nook through BarnesandNoble.com.
And you're doing book signings and you're on the radio. Big media blitz with you.
I'm passionate about this. I know I can make a difference.
We're out of time. Great stuff. But, it's not. You're changing people's lives.
I am changing people's lives.
All the time.
Day to day, every day. I had a patient, I've seen him now for about 6 months. When he first came in to see me, he'd had severe low back pain and had gained about 30 pounds. And he was in so much pain he really couldn't move. So I did the traditional doctor stuff, put him on a little bit of medication and did a series of epidural injections, put a little cortisone in his back, but calmed that pain down. But I think the biggest thing I did for him was really kind of open his eyes about how important it was for him to take care of his health and get proactive now. That 30 pounds was going to make my job as a pain doctor very difficult. But in addition, his blood pressure was starting to creep up and his blood sugar was starting to creep up. So he was on his way to being pre-diabetic. And 1 in 3 of us are pre-diabetic as well.
Okay.
So you're a time bomb there, my man.
All right.
You're
okay.
a
So
time
I'm
bomb.
next.
You are. Anyway, he took what I had to say to heart, and I saw him, like I said, just the other day. He was back in. He was down 20 pounds. His blood sugar was back under control. He won't have to go on medications. And his blood pressure's well on the way.
Is he embracing the exercises? All of the exercises?
Well, not all of my exercises, but he's making it work for him. The book is a guide. You don't have to do every single thing, every step. I'm just giving you the guide. Step by step, easy to follow.
So this is all science-based?
All science. All science. You know me, I'm as honest as they come.
Okay.
I would love to be able to create hype and hooey and make $1 million right off the bat, but it's not. It's all science.
But for those people that have never been to the gym or never hired a personal trainer or things like that, I mean, this is the perfect book.
This is the perfect
to get them
book.
started.
Things to do on a day-to-day, minute-by-minute basis, and just start walking 10 minutes a day.
It's also nice that you walk the talk. I mean, you're physically fit, medical doctor, exercise physiologist, and you love this. I mean, it's like you're proud of this book too. Because I know you have a couple of kids, you're very proud of them, but you really love this book.
But it's doable. You're right.
Okay.
I'm a doctor. I've written a book in my spare time, and I've raised 2 teenagers. Now, obviously, I don't have time to be a fitness fanatic, and it doesn't take an enormous amount of time or that much effort. I swear, when you know what to do. I'm the example.
It is an easy read. I told you I read the first chapter, and it is like you talking.
Yeah, it is.
Right, I want to thank you so much for coming on the program. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, we also have it on our website at wellnesshour.com under exercise, nutrition, or weight loss, or you can just type in Dr. Ruth Anderson. And if you want her book, Get Moving, Live Better, Live Longer, you can buy it on Amazon or her website. For now, wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.